I would love to let people know that a couple of years ago, you were gracious enough to come, well, you were going to lecture for us at one of our IABDM meetings.
Yes.
And unfortunately, you were supposedly struck down by something life-threatening.
Yeah.
Gave you the opportunity to share with people that just because a doctor says you're going to die in a couple of months does not mean that it's going to happen. So can you please, before you get started, quickly share that story with us, because it's amazing.
Thanks. Absolutely. So September 2018, specifically September 19th, 2018, I had been having some pain in my shoulder, my chest, doing lecturing and traveling from airport and whatever. And I finally went to my doctor and I said, you know, I got some issues. He said, yeah, let's do some blood tests. Nothing really came back. We did an MRI. Looked at the MRI. He called me and said, either come in or I can talk to you over the phone. I've seen him for 35 years. I said, Billy, let's talk over the phone. He says, I'd be concerned. I think you have either lymphoma, leukemia, or multiple myeloma. I didn't want any of those three doors. Fast forward a few days later, he brings in an oncologist. I'm diagnosed with IgA kappa light chain multiple myeloma with multiple innumerable skeletal lytic lesions. The reason I was having pain is because I had a cracked rib, vertebral compression fractures, and a cracked pelvis. And I am blown away. And he gives me 3 to 5 months to live. So theoretically, he wanted me to get into chemotherapy, a cocktail of drugs and all kinds of stuff. And he and I had this conversation with my wife and my adult children in his office. And I said, well, is this going to cure me? He said, unfortunately, your disease is incurable. And what will happen is you'll go into remission, and then eventually it'll go out of remission. You'll have to go on to a new cocktail of chemotherapy drugs, which are more caustic because the original cocktail would not work any longer. Eventually, I would succumb to the manifestations or what would be the cause of death from multiple myeloma, which would be either bleeding to death or an infection that couldn't be taken care of or kidney failure. But all along with the chemotherapy, I would have a decreased quality of life. I wasn't up for that. So I did my research and found some unconventional cancer protocols that I integrated. And look at me, it's well beyond 3 to 6 months. I'm doing extremely well, better than ever before. The only problems that I've had were some severe pathological fractures. Actually, the biggest fracture was when I broke my femur in half, my right humerus in half, and broke 2 ribs when I collapsed in my bathroom because I twisted without realizing it. My bones were so fragile. I broke my leg at the time, and I just collapsed on the floor. And I was obviously taken to the hospital. I was in hospice. I was ready to die. And that was September of 2019. But lo and behold, I rallied. My body is great. And here I am talking about dental nutritional counseling program. Amazing.
And I don't see you in a bubble to keep you from falling down.
No, there's no bubble. Let me tell you, I got to tell you, I don't know how much time we have, but I just have to tell you that because I'm doing what I'm doing unconventionally, I'm really supporting my immune system better than I should, because my disease is a disease of malignant plasma cells, which means I can't produce the antibodies that I need to resist the common cold. So maybe 6 weeks ago when I saw my oncologist, who I see every 2 to 3 weeks anyhow, he said he and his physician's assistant had a severe case of the flu. Of course, all the hospital staff had to take the flu vaccine. That's another story, obviously, but that's how effective the vaccine is. So he is sneezing and coughing, and he's got a mask on, and his PA has a mask on, and I'm thinking, because of my resistance, I might get really sick. I didn't even have a sniffle.
Good for you.
So I'm good. I'm good.
Yes. Yeah, so tell people who really don't know much about you. Yes, you are a periodontist, but tell us a little bit more about yourself.
Sure, of course. I obviously a periodontist. I've been in practice. I retired when I was diagnosed. So I stopped practicing periodontics in September 2018. But I am also a certified functional medicine practitioner. I'm a certified Primal health coach. So I've got all this background that makes a lot of sense, yet I came down with a malignancy, a bone marrow cancer. And I can tell you that I believe my cancer is related to the 4 years in dental school and 2 years of graduate school. And you only have to have something that causes one cell to become malignant that doesn't want to die naturally, and that one cell will repopulate to billions of cells, and eventually 40 years or so later, it manifested into multiple myeloma. I think the cause was constant low-dose ionizing radiation, because I was exposed to dental x-rays constantly. In our clinic, we were one of the first where dental students, we had 4 dental students in separate modules, shared one x-ray machine. And for 4 years in dental school and 2 years of graduate school, the whole dental school was exposing us to x-rays. We didn't use badges in those days, in the very, very early 70s. And then we placed mercury fillings. We played with mercury in our hands like kids play with Play-Doh today. We threw excess mercury when we, after trituration, you squeeze it with a squeeze cloth in those days, and you threw the excess little balls of mercury on the floor. And the floor, it evaporates. It becomes now vaporized. The dental school was the most toxic environment that you could imagine for me as a student, for the instructors, for the patients in the school. It was just horrendous. And I think that those two things triggered something in my body to kill or cause one plasma cell to become malignant. And then over the years, 40, 45 years, no matter what I was doing, maybe I was avoiding the manifestation, but eventually it overcame me, and here I am. That's my story.
I know you have a great presentation for us, so I'm not going to keep you any longer.
Well, that's okay. This is fun.
Had a good understanding of what a varied background you have. So go ahead and present your program for us.
Okay, so tell me, is everything showing? I don't know.
I can see it on my screen.
Can you see a slide that says Dental Nutritional Counseling Program?
I can.
Perfect. So let's go. So this is a program that I literally created, and tried to circulate among dentists. It is an in-house science-based program that I think can be a game changer for practices that really want to understand what dental diseases are being caused by. So what I plan to talk to you about is some basic facts. Maybe I'll bore you a little bit, but some basic facts. And I do believe that the dental office is a perfect platform for a program like this. I mean, let's be realistic. Who else looks at the mouth for as long as we do? If you go to a physician who knows nothing about the mouth, by the way, and he says open wide, and he takes a little piece of wood and he sticks it around your tongue, what is he looking for? Even if he knew what he was doing, it was like seconds. In a dental office, we have the perfect platform to talk about what's going into the mouth that is good and what is going into the mouth that is bad. So I'm going to talk about why the dental office is such a great platform for this program. And also, I'm going to give you some peer-reviewed research. Now, this research, really, you can take home with you. This is, I'm only going to talk about 3 papers. 2 of them are on human studies. It's not animal-based. It's really human research. And then the other is a meta-analysis of a lot of other research in humans talking about tooth decay. So again, I'm going to get into the very specifics of this in-office evidence-based nutritional counseling program. And so I'm going to talk to you about some marketing tools to get people more involved in understanding what this program is and get it out to the community so you can start it and make some money with it. What I think you need to understand is that, you know, we'll talk about how patients come into the office. You see patients that are brushing and flossing correctly. They still have bleeding gums. They still have tooth decay. They still have bad mouth odor. They still have all kinds of other chronic diseases. It has nothing to do, for the most part, with brushing and flossing. There is a fire raging in these people, and the fire, unfortunately, if you just kind of put a hose on the fire will not go out if you're still stoking the fire with something that's causing it to burn like gasoline. You not only have to remove or try to put out the fire, but you have to remove what is causing the fire. So if we take a look at our primal ancestors, if you believe in evolution, which I do, you will know that our modern humans, maybe humans were evolving for 2.5 million years, but modern humans go back about 160,000 years. Now, these humans didn't have toothbrushes, didn't have dental floss, they didn't have 6-month dental cleanings in a dental cave, they didn't have any fluoride other than maybe natural fluoride in the water, but they practically did not have any gum disease or tooth decay. And I'm going to show you how we know that. But if you look at the prevalence of gum disease today, there was a study that was published sometime in the early 2010 area, something like that. And it was done with a bunch of college students. And it turns out that almost 94% of these college students had some form of gingival inflammation. We're talking about gingivitis. We're talking about infection. We're talking about a significant epidemic of infection, because hopefully we all know that the gum tissue should never bleed. The gum tissue should never be red and inflamed. Certainly if you look at the cuticle in your, around your nail, it's not red and bleeding. If you're brushing your teeth or you're putting your makeup on, you know, whatever sex wants to do that, if you saw a drop of blood that came out of your ear, you would be very concerned. But no one is concerned about a little bit of pink on dental floss or a little bit of pink on a toothbrush. As a matter of fact, I've been around for a long time. I know hygienists that say to patients, well, it's only bleeding a little bit. A little bit, give me a break. 47% of adult patients have periodontitis, as you know. And that study was done in 2015, I think, something like that. And 70% of adults that are over the age of 65 have periodontitis. So this is a very epidemic type of chronic disease. And then if you look at tooth decay, the World Health Organization has said that tooth decay is the most infectious, non-communicable global disease. 91% of adult patients have or had some form of tooth decay. Again, we shouldn't have decay in our mouth. And here's the problem. It ain't so much the things we don't know that get us in trouble. It's the things we know that just ain't so. We think we have the answers, but we really don't. Let's take a look at our primal ancestors. Skeletal remains really tell quite a bit of the story. And today we understand, we know how to do DNA testing, which is amazing. I mean, science is amazing. We can actually take a skeleton and remove some of the tartar around the tooth and actually identify the bacteria and what is in there. And we certainly can identify if it's in a state of balance or not. So if we look at skeletal remains between 10,000 to 20,000 years ago, which has been published, there are very few signs of tooth decay. There are very few signs of alveolar bone loss, which obviously there's no active periodontal disease or very little. And when they take the sample of calculus but that is around the tooth, they find a bunch of bacteria. But the bacteria is in basically a state of homeostasis. How do you know? Well, there's no tooth decay or periodontal disease or bone loss. 10,000 years ago or so, things changed. And we developed farming, and we started to grow grasses. And we found out that if you could take the seeds of grasses and pound them down, and you could make a flour out of it, you could create bread. And bread is a grain that is loaded with phytates, chemicals that actually bind to minerals, and it does a variety of bad things to your gut bacteria and your gut membrane, which we're going to talk about. And this is the time when all of a sudden skeletal remains started to look a little different. There were certain changes, especially with tooth decay. And then about 170 years ago, fast forward from 10,000 years ago to 170 years ago, the skeletal remains showed significant tooth decay and alveolar bone loss. So something was changing in our bodies. Now, there were very, very healthy societies. If you are familiar with Weston A. Price, he was a dentist. I never learned about him in dental school. I have no idea why. But if you understand functional medicine, you're going to learn about what he did. He was an observational scientist. He actually did not do a lot of studies in the mouth, but he observed mouths. And he saw the jaw structures of tooth decay and how things related to primal diets, where they never used processed foods, they never used flour foods, or other societies in his day that actually ate processed foods and flours and sugars. And he saw a huge difference in the shape of the jaw and the tooth decay that was prevalent in gum disease. There are primal societies today, and I have a list of them. The Hiwi, the Aceh, the Inuit, and you can see in this slide, they eat a variety of types of foods. The Hiwi eats 75% animals. The Aceh, 78% animals, and some honey. The Inuit, almost 100% animals. The Kung eats kind of an in-between third of animals, nuts, and seeds and plants. The Hadza eat about the same amount of plants as they eat animals. But none of these societies have the prevalence of tooth decay and gum disease, periodontal disease that we see today. Now, also, there are no primal societies today, and there have been no primal societies in the course of evolution that have been vegans or vegetarians. I'm sure I'm going to get a lot of phone calls about that. No one knows my phone number, no problem. But vegans and vegetarians, our systems, our physiology was never designed to eat all plant items. Also, primal societies don't eat overprocessed vegetable oils like canola oil and corn oil and soybean oil and a million other oils. They don't eat refined sugars. They eat sugar that are in fruits, maybe. They eat honey, which is a unique product. Actually, it's an animal product. But they don't eat processed sugars. They don't eat overprocessed grains. They may eat grains, but they certainly don't eat the white flours that we eat. They don't have any toxic substances in their food supply. But they do, when they do eat animals, they eat the animals head to tail, meaning that they're not just eating a piece of filet mignon, which is maybe tasty, but really not the healthiest part of the animal. The healthiest parts of the animals are the organs and the fat and the collagenous parts. So when you look at these primal societies today, and there are only a few, but if you look at them and do some medical studies, you will find that they hardly have any blood pressure problems. They don't have cholesterol problems. They're basically skinny. They're not obese. Type 2 diabetes is not a common term or a common disease. And other chronic diseases are just not there. And they're very aerobically fit because they literally have to move and function aerobically to survive. They also, when studies have been done with scientists looking at the actual microbiome in their gut and in their mouth, they have a huge variety of species. They don't just have a few. And they have species that if you were to identify a species, you might term it as a pathological species, like P. gingivalis. Porphyromonas gingivalis is a very virulent bacteria that is also associated with severe periodontitis. Not the only one, it's actually one of many. But everybody has P. gingivalis in their mouth. Everybody needs P. gingivalis in their mouth, as long as it is among the other types of bacteria to create balance. We have 700 or so different species of bacteria in our mouth and thousands of species of bacteria in our gut, but they're in a state of balance. These primal societies, like I said, don't eat processed foods, and they hardly ever have gum disease or tooth decay. So what happened? What happened to modern man today and our primal ancestors before and the primal societies that are in existence today? Something happened to our cellular structure. Something happened to the biological chemistry that is in our mouth. Something happened to the immune system that our bodies are dependent upon to stay healthy. And I will just interject that the COVID-19 virus that we're dealing with the prevalence of this virus because we, as a society, do not have healthy immune systems. Now, I can go into much more detail later on, but that's not really part of this explanation. I did write a paper that is on my blog, and if you go to my website, drdanenberg.com, I have a cure for COVID-19. And the title of it, The Cure for COVID-19, Hear Me Out. I'm talking about how we enhance our immune system so that we can fight our invaders, our antigens, which certainly COVID-19 is one of them. So something happened. What really happened? Do we know the etiology? Well, Primal Man never went to Burger King and McDonald's to get their meals, so maybe that's part of the etiology. Most people think it's genetic. Genetic, theoretically, is a determinant of the way we are going to live. That's totally incorrect. It's the same thing with cancer. We may have genetic genes that are going to predispose us to cancer or periodontal disease or some other chronic disease. But we don't have to upregulate those genes to give us the disease, because there is another thing called epigenetics, which is our surroundings. And that is actually going to cause our genes to either express themselves or not express themselves. And 90% of all disease, all chronic disease, is related to our epigenetics. It's the way we live, and it's the way we eat. So let me ask you a question. If you were standing on some train tracks, you know, you're going to play everything. Everybody wants to play on train tracks at one point in time in their life. But all of a sudden, there's a train coming. What are you going to do? The obvious is to get off the track, stupid, right? You're not going to wait for the train to be on top of you. But do we really do that? And how far away does the train have to be? So if you knew smoking would kill you, well, what would you do? If you knew drinking Mountain Dew 3 times a day, like, you know, you see kids in the office and their moms come in and they have a can of Mountain Dew, you know right away there's not going to be an easy education process going on. If you knew you were poisoning your body, what would you do? Would you make a change? Well, we're interestingly creatures of habit. We really don't want to make a change. We are conforming to routines in our life, which is great. It gives us a sense of awareness. Change is difficult. even if you try to make a change, you have to institute habits for at least a month before it even becomes a routine. But you know, there are tipping points. There are reasons why a person would make a change. A lot of times, somebody's getting married, they want to change their life. Great, they want to clean up their life. Terrific. They change their job, and maybe that's an excuse to change their lifestyle. Certainly, if you have a child that's born, or you're a grandparent and you have grandchildren like I have, you may want to see your children, certainly your grandchildren, grow up to get married and make themselves successful in life. So that may make you want to change your life. Certainly a life-threatening event, having a heart attack, having a diagnosis of cancer that's going to kill you in 3 to 6 months may cause you to say, you know, maybe I need to stop smoking, or maybe I need to stop eating this that really caused some other issues. And sometimes, and it's very rare, but sometimes people just need facts to make a change. That's not really most people, but that is true of some people. Just give them good evidence and they'll make a change. So what happens is, and what we're going to talk about in detail is that there are unhealthy food choices. One is free sugars. Now, free sugars is not the sugar that's in a grape. It's not the sugar that's in a strawberry. But it is the sugar, the powdered white sugar that you put on the strawberries to make it sweeter. It's the sugar that you add to anything to make it sweeter. It's concentrated sugars like orange juice. Orange juice is extremely unhealthy. It's got a lot of acid. It's got a lot of sugar and maybe a few nutrients. But basically, if you want to have a healthy vegetable or fruit like an orange, eat the orange, but don't drink the orange juice. Free sugars are a significantly unhealthy food choice, not only because it can cause tooth decay, but it damages the gut microbiome that we'll get into, which sets a series of events that cascade to create the problems in the mouth. I want to emphasize this, which is critical. The mouth bacteria doesn't cause the disease initially. The disease is caused by something that changes the natural balance in the gut, that then changes the immune system and its ability to fight off infection, and then it changes the body's other microbiomes, like in the mouth, that allow overgrowth of pathological species. Then free sugars just feed these. If you have a healthy gut, you will have a healthy mouth. Other foods that are unhealthy foods are grains. These are the seeds of grasses that have phytates, chemicals that are very unhealthy for binding to minerals that are necessary for the mouth as far as mineralization of the teeth, as well as they have a variety of types of proteins, gluten, for example, that is very, very destructive to the gut. And sodas, as you know, all sodas are extremely acidic, well below the pH of 5.5, where the mineralization of the tooth occurs. So these are the 3 healthy food choices that you are going to train your staff to identify with patients as I go through this nutritional counseling program. There are other unhealthy food choices that we're not going to really get into, but as you maybe get into the research on your own, you and I, if you want later on, we could have a much more detailed description of how to really get healthy. Some of these other unhealthy foods are unhealthy fats, lectins that are in some fruits and vegetables, oxalates in fruits and vegetables, phytates, which are in the grains, chemical emulsifiers that damage the gut, preservatives damage the gut. Glyphosate does a huge destruction of the gut and does cause cancer. Dyes, chemical residues, and all kinds of things like that are unhealthy. So you might want to know what is really healthy if I'm just eliminated all the foods that you think are good and tasty. Well, actually there are a lot of great foods that are healthy, but a lot of the foods that we're going to talk about are foods that have good omega-3 fatty acids, have good vitamin C, have good vitamin D sources, have good vitamin A sources, have good vitamin K2 sources, have antioxidants, have fiber, have magnesium. These are elements, nutrients that have been shown to be extremely beneficial and necessary for us to survive and thrive. And when we're doing our shopping, we need to be very aware of the foods that have a USDA organic label. Now, there are problems sometimes with cross-contamination, but basically for a company to acquire the USDA organic label, number one, they have to spend a lot of money to do that, but they have to prove several things. One is that they have to prove that their product has no synthetic fertilizers, pesticides, or sewage sludge in the process of growing these plants or raising the animals. They cannot have any genetically engineered or irradiated processes for their product. If we're talking about animals, they must eat organically grown feed, and animals have to have access to pasture, and they cannot be cloned. Believe me, I can't believe it, but there are meats that are actually cloned animal products. Not for me. So I want to try to put all these pieces together and create something that really makes sense and also can be instituted in or implemented in a practice that is a busy practice that actually will set you way above the average or even the theoretical biological practice that is not even talking about nutrition in the way I'm going to explain it. So let's start with the mouth. So what is it? You know what the mouth is, but what you may or may not be aware of, or not, that you are aware of it, but you don't think about it all the time, is that it literally is the mirror to your body. Most chronic diseases actually show changes in the mouth. Now, the changes may be similar to other changes that are created by other systemic diseases, but the interesting thing is the starting point of all chronic diseases is really the gut. So your mouth is a mirror of your gut health. And your body is so intimately and intricately connected back and forth. Your mouth is the portal to everything that's going inside, especially nourishment. And obviously, this is where diet starts. So we start with a little kid, and they're starting to eat a piece of bread, white flour bread. It's the beginning of a disaster. I know that I'm going to step on a lot of toes, but white flour products or even other grain products begin to create lots of problems with the gut, the amount of sugar that is in your blood system, and it certainly can progress to this delicious meal. And if you do it enough and you're destroying your gut enough, this is what your gut starts to look like. And I can tell you that what's going on in that person's gut is totally destroying the rest of his body. So I want to go over some research, and this is research that really, really makes sense. This study that I'm going to talk about at first is what was called, and it was published in the journal Periodontology, the Stone Age Diet and Gum Disease. It was done by Dr. Baumgartner, published back in 2009. And I'm going to talk about the summary in a moment, but let me just give you an idea of how unique this study was. And it was really mind-blowing for the researchers. 10 people were in the study in Switzerland. And these 10 people were going to live for 30 days in an environment that replicated what primal individuals lived on 5,700 years ago. Now, these individuals were given some food products, but the rest of their food they had to forage for. They had to dig for. They had to. They were not allowed to kill animals, but they were given raw meat that they could cook, and they had substances, but they had no processed food. No processed food. No breads. No sugar. no cereal, nothing that was processed. So these individuals, for the beginning of the study, had several parameters evaluated: bleeding on probing, the depth of the periodontal pockets, and they had cultures taken of the bacterial plaque around the tooth, of course, and the bacteria that was on the surface of the tongue. So that was evaluated. And then these individuals could not brush or floss for 30 days. Imagine that. So the researchers figured that at the end of the study, they'd have lots and lots of bacteria and lots of bleeding gums, and they would be able to prove that if you didn't brush right, you had lots of dental disease. Well, here's what's actually interesting. They removed all the processed foods, and the signs and symptoms of gum disease at the end of 30 days improved. They had less bleeding on probing. They had less pocket depths. And when they did the culture of bacteria, they had gobs and gobs of bacteria, but the bacteria were in a state of homeostasis. They had improved oral health, but lots and lots of dental plaque. And the bottom line from this study is that bacteria in dental plaque is healthy until it becomes unhealthy. So basically, dental plaque, when it's balanced, is a very healthy biofilm in the mouth. You don't want to scrub and remove the dental plaque so that this red dye that you use disclosing tablets, you don't want to eliminate every ounce of plaque and strip the surface bare. Here's another study. The complaints of the original study with Baumgartner is that there was no control group. So this study was done by Johann Wobler in Germany. He's a periodontist, a researcher, and this was a randomized controlled trial. So he had a control group and an experimental group. The control group, well, all of the patients that were part of the study had to have active periodontal disease, and they had to be eating pretty unhealthy food, which we would call a standard American diet. Lots of refined carbohydrates and sugar. They had lots of bleeding on probing and inflammation. So they were an unhealthy group. They were divided into one control group, one experimental group. Both groups would be evaluated for a month. One group, or both groups, could clean their mouth with a toothbrush, but they could not floss or use interdental cleaners, interproximal cleaners. One group that was a control group continued to eat their junky food for the next 4 weeks. The experimental group was strictly enforced to eat healthier foods, no processed foods, no processed carbohydrates, no added sugars. They ate a healthy diet that consisted of mainly plants and a few animal products, but no processed foods, no sugars. At the end of the study, the ones that actually eliminated the free sugars and processed grains actually included healthy foods, reduced their signs of gum disease and inflammation. The other group, the control group, that continued to brush but didn't clean between the teeth, just like the experimental group didn't, but they continued to eat their junky foods, had a 20 to 30% increase in bleeding gums and pocket depths, and a very active, unhealthy culture of bacteria. So again, and this was important because it was a controlled study, again, if you eliminate processed foods and free sugars, even if you're not cleaning your mouth correctly, you will reduce the signs of inflammation and actually improve the health of the gum tissue and the bacterial dental plaque. This other study is not really a human study. It was a meta-analysis of many, many other human studies, and it was related to tooth decay. and sugar. This study was published in the Journal of Dental Research in 2015. And what they showed was this, and it's very interesting. Dental diseases are absolutely diet mediated. And the other two studies showed that. Free sugars are the cause of dental decay. Free sugars obviously feed unhealthy bacteria in unhealthy plaque, and also the free sugars are creating the unhealthy gut microbiome that affects the immune system, that affects the plaque in the mouth, because it becomes a vicious cycle. Healthy plaque then becomes unhealthy, and the bad bacteria overgrow, producing the acids and create demineralization. This study showed that just starchy foods will not cause decay unless there are free sugars associated with eating the starchy foods. So free sugars are the cause, and if you were able to eliminate free sugars from a diet, you will not have tooth decay. It's an amazing statement. So here's what happens. We create a vicious cycle in our body. Acellular carbohydrates are these processed carbohydrates that I was referring to. And these carbohydrates get into your gut. You eat them, you chew them, you swallow them, gets into your gut and changes and damages the natural balance of bacteria in your gut. The term for that is called dysbiosis. When you have dysbiosis, unhealthy living bacteria in your gut, it irritates the membrane that surrounds the gut, which is one cell layer thick, and you develop holes in the membrane called increased intestinal permeability, and the colloquial term is a leaky gut. When you have leaky gut, things get into the blood system. Your immune system gets triggered. It creates chronic inflammation that affects the overall immune system, and it leads to the chronic disease of dental disease, as well as every other chronic disease in the body. So if you look at a picture of a section of the small intestine, where the arrow is the damage, the hole that is created between the one cell layer thick membrane. If you look at the two cells to the left of that arrow, it looks like there are three horizontal lines. These are what's called tight junctions, where the cells are literally tight. They open up slightly to let nutrients that are completely digested into the bloodstream, and then they close. But when you develop a dysbiosis and damage to the gut, these holes, these openings between the tight junction of this, where the tight junctions seal the cell, become much, much larger. They stay open much, much longer, and particles of food that are not fully digested and other toxic elements that should have gone through the intestines eventually into the feces are actually penetrating into the bloodstream, creating the chronic inflammation, causing periodontal disease, tooth decay, and other chronic inflammation. So what happens is when you're eating unhealthy foods, and there are other factors that damage the gut microbiome that I could go into in much more detail, but when you're eating unhealthy foods and it's affecting the gut microbiome, and you have infection and inflammation in the gut and a leaky gut, and then you develop gum disease because it's changed, your immune system has changed the bacteria components in your mouth, and you're eating this really junky food that's feeding the pathological bacteria that are overgrowing, you're developing periodontal pockets that actually leak into the bloodstream just like the gut. Now you have two Niduses of infection. And the problem is dentists never understand what's going on in the gut, and functional medical doctors think that they know what's going on in the gut, but they don't have any idea what's going on in the mouth. So if you have a leaky gut and a leaky periodontal pocket, you can't treat one and not the other to get a healthy result. It doesn't work. You can destroy the bacteria in the mouth. You won't have any gum disease, but you haven't changed the damage that is leaking into the bloodstream from the gut, and it will affect the rest of the body, and vice versa. If you only treat the gut and you're not treating the mouth, you know that the mouth will participate in the spread of chronic infection throughout the body. So an untreated leaky gut, untreated dental disease, both must be treated, especially when you can understand that this pathology not only moves through the bloodstream, it moves through the lymph, it moves through nerve tissues. That's actually possibly the physiological definition of the meridians, because the nerve tissues are part of meridians, and it may be actually contributing to the pathways to different nerve organ systems. So it's a very interesting set of circumstances, but we have two Niduses of infection, and the mucosal tissues of the entire body crosstalk. They communicate. The bacteria talk back and forth. They know what's going on. So we have to treat everything concurrently, or at least after we get the initial immediate acute infection under control, we must treat the other underlying causes, especially the gut. So basically what I'm going to recommend is a nutrient-dense anti-inflammatory diet. Nutrient-dense just means that there are many, many nutrients the body needs per calorie of food. So certain foods have lots and lots of nutrients per calorie. Other foods, you need to eat maybe 100 grams of food before you get a few of the nutrients in your body. So when you're eating nutrient-dense foods that are anti-inflammatory, not causing inflammation in the gut, it obviously prevents the inflammation in the gut, but it improves the gut microbiome. It prevents and heals the intestinal membrane, the epithelial barrier. It will prevent chronic inflammation, and it stops chronic disease. So what I want to do now is talk to you about my program, evidence-based in-office nutritional counseling program, which you can initiate as soon as you get back into the office, once you get the logistics under your belt. So let's say a patient comes into the office. Now what are you going to do? So if you have an acute problem, infection or broken tooth or whatever, you're obviously going to take care of the acute infection. You're going to take a look at the mouth and do an exam. Now if there's too much calculus or junk in the mouth and you can't even see what you need to see, you'll do a debridement, and these are the dental codes for a debridement. And clean up the mouth, you'll do your thorough exam, and you'll determine what next steps need to be taken by the patient. You'll create a treatment plan. Maybe they have lots and lots of health, you're not even going to talk about anything. But if there are signs or symptoms that you think are related to gum disease and tooth decay, I would recommend that we get that patient started, if they're interested, in this very unique nutritional counseling program that you're going to offer. And the American Dental Association has been smart enough to create a code for that, and it is D1310. Most insurance companies don't pay for it, but it's at least a code that is accepted and you can use for every individual nutritional counseling appointment that you create for the patient. So let's say you're talking to the patient, you're telling them this unique idea that you have. Maybe they came to you because you did some marketing that explains how unique and different you are from every dental practice in your area. So they want to know about nutritional counseling, and you're going to give them a pamphlet, give them some information, and you're going to get started. So the first appointment, the first nutritional counseling appointment would be the D1310. And you'll explain the process to the patient, you will answer their questions, and you'll give them a 3-day food journal, which I'm going to show you in a few more slides. A 3-day food journal is literally 3 papers, one each day, that the patient will fill out in detail that describes exactly what they're eating and what they're drinking for breakfast, lunch, and dinner, for any snacks. And if they have some comments, there's a little room for them to make some comments on. And what they're going to do is that once they've done this, they've completed the 3-day food journal, you're going to schedule another appointment. That's the second nutritional counseling appointment for another D1310. And you're literally going to interpret this 3-day food journal for them. And you will learn that you are looking for free sugars that are in that 3-day food journal, foods that actually have sugars. You're going to look at the foods that they're eating and look for grains that are part of the diet. And there you're going to look for any sodas, any and all sodas. I'm going to define all three of these in a moment. And most importantly, you are going to give them substitutes. Makes no sense if you tell somebody you can't have sugar if you didn't give them a substitute that's satisfying. It makes no sense that you will tell them you can't have bread on their sandwich unless you give them something to hold their sandwich together, or some substitute that's going to make sense and create a desirable food for them to eat. You can't tell them they can't drink soda unless you can tell them that they can drink this, that, or the other that's going to be just as good and certainly much healthier. So let's first take a look at this 3-day food journal. And unfortunately, it's hard to see, but basically, this is in the very top. You'll see one of the very small column meal and then the food and the beverages. There is an instruction sheet that goes along with this, but they're going to, at the time of their breakfast, they'll write down the time they're eating their breakfast and the foods that they're eating and everything they're drinking in detail. When they have a snack, if they have a snack, they're going to jot those foods and drinks down. And then you'll go through the rest of the meal, and on the bottom of the form, you'll have additional comments. And they're going to do 3 consecutive days. The instructions will be detailed, but one of the things that are important, or is important, that at least one of the 3 days needs to be a weekend day, because people eat a little differently on a weekend than during the week. So they could do a Sunday, Monday, Tuesday. They could do Saturday, Sunday, Monday, Friday, Saturday, Sunday. But you don't want to do Tuesday, Wednesday, and Thursday. You want at least one of the 3 consecutive days to be a weekend day. So here are an example of what free sugars really are. White sugar, brown sugar, raw sugar, organic sugar is sugar. All manufactured sweeteners, corn syrup, high fructose corn syrup, naturally occurring sugars that are concentrated into syrups and jams and fruit juices. All of these are considered free sugars and highly damaging to the gut and highly carcinogenic. Processed grains. These are the breads, sandwiches, rolls, bagels. You can read the list and you will see all of the things that everybody is eating several times a day. That's why, by the way, that 40%, or I'm sorry, 60% of the US population has some form of chronic disease. And approximately 70% of every death in the United States is related to a chronic disease. And these are the reasons that you have chronic disease, damaging the gut microbiome. And these processed grains that may taste good and are comfort foods are highly toxic to your gut. Sodas, any bottled or canned sodas that are either sugar or sugar-free. Even the sugar-free, the chemicals that are in sugar-free sodas are damaging to the gut. Also stimulates your mental capacity to tell your gut you're going to be drinking something sweet, and it stimulates your pancreas to produce insulin, and there's no sugar, so it creates other problems. Most of people think sport drinks are just very, very healthy drinks, but they're extremely unhealthy. So we're basically looking for sugars, grains, and sodas, and we're going to substitute sugar products for healthy products. We're going to substitute grain products for healthier products that substitute or duplicate what grain would be doing in the diet, as well as soda. And I have a list of foods that are great substitutes for these grains, sugars, and sodas. And what you'll do is fill out another form for this patient at the second nutritional counseling appointment, where you're going to show them that this bun on a McDonald's burger is not so healthy, but here's a healthier food choice. There are some gluten-free breads that are basically healthier, so you can use that. Or there are some companies, one is called Against the Grain, that makes a roll that will blow you away, and it's made with cauliflower and Parmesan cheese. And it is delicious. It has no grain products at all. So the substitutes that I have, you'll be able to write down for the patient, and they can start thinking about making changes in their life. And you're going to have to encourage them. You're going changes. You're just not going to give it to them and they're going to be able to do it right away. So you're going to have some follow-up nutritional counseling appointments. They may actually call the office and say, I'm having a problem here or a problem there. So you have to have some kind of chemistry that's developing between a staff member. The dentist doesn't have to do this. The hygienist doesn't have to do this. A staff member that is less on the hourly scale range of income to do this procedure and follow these patients up. I also included in this program how to teach what is really on a nutritional facts label that's always on any processed food in the United States. It's by law, it has to be there. And what is not really understood that much is the ingredients list. I mean, there are products that say they are very healthy. For the one that says original, the top right side, there's some almonds and shredded coconut, sunflower seeds. That's everything that's in the product that they know of. Of course, there are certain chemicals they don't even know that's in the food, but that's basically what they know is in the product. It has to be on the ingredients list. But these products on the bottom, actually, I took a picture of this at Trader Joe's that was supposedly a healthy product. Look at what's in it. It has sugar as the first ingredient, which means it's the highest percentage of the nutrient or lack of nutrient in that food. Invert sugar, corn syrup, modified corn syrup. That's junk. We're talking about junk here. So you're going to help educate your patients as to how to read and understand the labeling on processed foods. So this is the nutritional counseling program. And what I would do is once the patient starts, you'll maybe have them come back maybe in a week if it's critical, or maybe in a month, or maybe they're doing so well, you'll just do a 6-month follow-up, or a yearly follow-up, or they're doing so great you don't even need to do any more follow-ups. But it's important that you charge for each nutritional counseling appointment. And the fee that you charge, basically 3 to 5 times the hourly salary of the staff member that is providing this service. That would be a fair fee to charge for nutritional counseling programs, I believe. So what I want to go over are some ideas, thoughts to get the word out to not only the patients of record, but patients that don't even know you, and maybe even referring physicians and other healthcare professionals. You should and could make flyers and brochures for your office and include some really nice photographs and do some text that you need to create. But there are very expensive photo services where you have to pay to rent literally pictures, stock pictures to publish. But this is a website, if you go to it, it'll blow you away. It's got tens of thousands of free photos. These are donated photos from other photographers from all over the world that is in the general domain that do not have to be paid for. And it's called Pixabay.com. Just go into the website. You can sign up if you want to become a member. It's free, or you don't have to become a member. You just put some target words in their search column, like nutritious food or fruits or vegetables or health or diet, and you'll have thousands of pictures pop up, and you'll go through the ones and see what you like. These are 2 from that website. And you can use these for your flyers and anything and everything that you want to publish. Even if you're putting articles on your website, you could use these as graphics for your articles. I'm going to show you some ticklers, and this is a lot of reading that you may or may not want to do as a slide. I'll just read it for you if you want. These are things that you can publish. You could use these, you could use these as maybe radio ads. You could use these as information on a printed brochure. You could put together little emails, send it to your patients of record. But these are just statements. This one says, more than 9 out of 10 individuals in the U.S. have gum disease, tooth decay, or both. Our office is offering a new program called Dental Nutritional Counseling. Find out how this new program can help you. Call our office or visit our website to learn more. Here's another one. a little different slant. Do your kids have tooth decay? Do you have tooth decay? Most families have been dealing with tooth decay for many years. We're proud to announce that we now offer a cutting-edge program for you and your kids to get tooth decay under control. Ask us how you can learn about our dental nutritional counseling program. Here's another one. Bleeding gums and tooth decay affect almost everyone. Are you one of those who suffers? Do you know someone who does? We now have a program for you to be proactive and stop gum disease and tooth decay once and for all. Ask us how. Here's another. Does your breath smell? Do your gums bleed? Do you have tooth decay? Our office can offer a unique program to help you stop, reverse, and prevent dental diseases. Ask us how. So you can use those, like I said, for video. You can use those for email. You can print up and put them in every invoice or bill that you send out monthly, just to get patients to know what's going on. Now, I believe that you can really tap into an area that dentists just never do, and that is getting to other healthcare professionals in the community. And I'm not just talking about medical doctors, although that's a perfect source. I'm talking about spa owners. I'm talking about acupuncturists, chiropractors, pharmacists, people that come into contact with other people that may have health issues. And here is, and this is a little long, so it takes 3 slides to read it. So what you could do is get a list and send it to, let's say, your physician down the street. And you'll say, "Dear doctor, gum disease and tooth decay affect over 9 out of 10 people in the US, and dentistry has been dealing with these diseases forever. There is evidence-based research that identifies that certain foods and lifestyles affect the health of the mouth in various ways. Our office is offering patients a program titled Dental Nutritional Counseling. This is a program that teaches patients to be proactive with their nutrition and make changes to stop, reverse, and prevent gum disease and tooth decay in the future. One side effect will be an overall healthier body. And we are excited about the benefits of this program for your patients too. Let's schedule a luncheon and learn to show you the science behind the program and what we can accomplish. We can send you some printed information for you to review. Looking forward to hearing from your office. So what I would do is send these out to several offices, make some phone calls, follow up, and if they decide to do it, I would only have one office at a time with their entire staff come to your office. You can provide some food. I wouldn't eat pizza and Cokes. I would have healthy food selections. Give me a break here. And talk about what you're doing. And the reprints, the 3 articles that I talked to you about in the beginning, order the reprints and give them out to these potentially referring practices that have never referred to a dental office ever. And you are going to see a huge interest in these patients that are going to start coming, because medical doctors are loaded with dental patients. They just don't know. And this is going to help them because you're going to help their patients get healthier too. It's really a good idea. So in summary, gum disease and tooth decay are preventable, reversible, and curable. And I am saying the word curable. Yes, periodontal disease is curable no matter what any dental professional tells you in dental school. Nutrition and lifestyle are 90% of disease. And if you can decrease chronic inflammation, you'll decrease chronic disease. And the dental office is the best platform to educate and treat your patients nutritionally. So if you want to get in touch with me, please, my website, drdanenberg.com. No problem. Take a look at the website. I have lots of articles. I've been doing this for maybe 5 years. I have over 400 blogs. Go to the blog page. You can print out these blogs if you like. I talk about all types of subjects about the gut and the oral cavity and chronic disease. And actually, I talk about how I'm progressing with my unconventional cancer journey that I fortunately or unfortunately, started in September 2018. If you want to email me for anything, al@drdanenberg.com. I am offering, which is interesting, a mentor program to create a biological approach for other dentists. There are 2 periodontists that actually contacted me and got me excited about this. They want me to teach them how to be a biological periodontist, of all things. So why not? One of the things I've told them is, guess what? Your organization needs to be on their radar. They need to become a member of your organization in order for them to become a biological dentist. So I also have a book. It's a little dated, 2017. Things have changed a lot. I have a lot of new opinions about things, but Crazy Good Living is basically a process of changing diet and lifestyle. So I would love to entertain some questions if you want to have some questions.
Oh. I think that Chai asked, what about the phytates and like, let me see if I can find what she said. She said, regarding bread, what about sourdough? Does the fermentation?
No, it does not. It has nothing to do with gluten, unfortunately. So sourdough is not a good substitute.
I think that, okay, let me see. She's got, Gayatri has 2 questions. Go ahead, Gayatri. Unmute yourself. Ask.
Okay, you may hear my kids in the background. Sorry about that.
That's fine.
Okay.
I can scream too, and we can compete.
So my first question was, what a great presentation, by the way.
Oh, thank you.
I loved it. My first question was, as far as, you know, my kids every morning, they're having cereal. That's their breakfast. Yeah. That's their to-go. What would be a good replacement for that kind of gets us away from the cereal thing?
I have on my website resources, paleo recipes, and I have a no oatmeal recipe that uses ground figs and a few other nuts and seeds that are ground up. Literally tastes like oatmeal. It's really, really delicious. You might want to try it. There are some grain-free rice-type products, cereals, which are certainly a grain, but it's not a wheat or barley or rye-based grain, and it does not have any gluten. So if you wanted to look at some of the gluten-free cereals, you could do that. A lot of carbs, but still it's a much healthier choice. But if you go to my website and under resources and drop down to paleo recipes, just type in oatmeal, you'll see that recipe for no oatmeal, which is really quite good.
Well, I have a question for you. The
Yes.
IABDM really doesn't have a committee for perio.
Well,
And
why not?
I would love to know if you would head it up.
Sure. I mean,
Okay.
you know, let's talk about the details, but sure.
All right.
This is my bag.
Sounds
love
like
it.
a winner.
Yeah, that sounds great. Let's talk.
I'm curious. I was listening to the first part of the presentation. We were talking about different cultures and how they didn't have toothbrushes or floss or anything. I know that the IOMT at their last meeting said that it's not important to floss anymore. That
I agree.
We don't need to stress that to our patients.
Yeah, I agree, but that comes with a caveat. That's true if you're really eating a healthy diet and you're not ingesting chemicals that are damaging the gut microbiome, and dirty electromagnetic fields are not affecting your gut microbiome, and you're sleeping well, and stress is under control. There are a lot of other factors that can damage the gut microbiome even if you eat healthy. So if you're eating healthy and you have other factors that are damaging the gut microbiome, you will have an unhealthy immune system, and you will have unhealthy dental plaque, and if you're not cleaning your mouth well, you'll have problems. So I don't like flossing so much. I think it's great to get fibers from the contacts between the teeth, but I don't like flossing because most people are, when they floss, they're aggressive. They floss into the gum, they saw through the gum, they create clefting, which creates all kinds of periodontal problems. So I like flossing just to remove food fiber or whatever that's stuck between the teeth, like meat fiber or you know, stringy vegetables. But I like the interdental cleaners, like the, for example, I think I even have a slide. I'll show you. Are we still looking at slides now, or is that gone?
Yes, we
Okay,
are.
so these little interdental cleaners are great. This is a company that I love called TEPE, and this is better than the gum. And the reason why it's better is that the gum interproximal cleaners, when you push them through and you bend them, they're done. You have to throw them away. The TP is more flexible, and actually it's easier to reuse them. You just wash them off, and you can use them maybe 4, 5, 6 times until the little silicone bristles kind of pop off. But they are fantastic. And here's another very interesting thing, and this is even diagnostic for a dentist. If you use these TPs throughout the mouth, and you're rubbing them at the gum line between the teeth, and you see any bleed, even if you're probing and you won't see bleeding sometimes, and you use these, if there's inflammation, it's going to cause interdental bleeding. It's going to be a sign to you, and of course the patient is going to have a mirror to see they have active periodontal disease.
And these don't blunt the papilla?
No. No, they're very soft. You know, they rub the papilla, and that's why if you have infection, it's going to cause bleeding, but it is extremely effective in removing the unhealthy dental plaque between the teeth.
And we have a question here from someone who's asking about juices where the fibers have been removed. Talking about using a juicing machine versus using something like a Vitamix. Okay,
so I do not believe in juicing zero, because the fiber is the better part of all of that. So I do like full, if you're going to use whole food and you want to juice it, I would use a Vitamix and save and eat and drink the fiber and not do the juicing. The juicing concentrates the sugar, you get some, you get a lot of acid, and you get some nutrients. There are other forms of eating that we can go over at another time. I am actually not doing any plant-based eating at this point. I am on a carnivore diet, and it's some interesting research that shows the carnivore diet is not only biologically healthy, it is what our ancestors really were eating for the most part all the time. And all the nutrients our body needs are in the plant, the animal, not just the meat. Only the meat is very little, but the fat and the organ meats and the collagenous parts. And here's what's interesting: the animals eat the plants, and there are lots of toxic substances that damage our gut. Oxalates and lectins are 2 of the biggest ones, and the animals have a gut that's designed to destroy and eliminate those toxic substances, and the nutrients are absorbed in their fat, muscle, and organ meats. When we eat the healthy animals, those nutrients are biologically available to us. And let me just mention something very interesting about vitamin C. The vitamin C that you can get from organ meats like liver is different than vitamin C from plants. Vitamin C from plants is not heat stable. Vitamin C from liver is heat stable. And if you are not eating lots of carbohydrates, in other words, a carnivore diet, 0 carbohydrates for the most part, carbohydrates, glucose, competes with vitamin C to get into the blood, human cells. So if you're not eating excessive carbohydrates or any carbohydrates, you don't need that much vitamin C to get into the blood, cell. So there's some very exciting research about that. So I'm doing the carnivore diet, not for all those reasons. I'm doing the carnivore diet because there is some very good research in Budapest, Hungary that shows a strict carnivore diet can literally cure cancer. And those are published outside of the country. I can't say that inside the country because the FDA doesn't allow that. But Budapest, what's called Paleomedicina Clinic in Budapest, Hungary, has a very large number of case studies published over the last 10 years of strict animal-based diets curing most chronic diseases and cancer.
And you're living proof. Al, our tape is going to run out for this
Oh,
evening.
okay.
But can you go back and show the slide how people can contact you? And
Yes.
I want to thank you for sharing with us this evening, and hopefully we can get you to do it again. And I do want to get you more involved
Sure.
with the Academy, and thank you.
It's my pleasure. So drdanenberg.com is the website. You can go to the contact information there. And if you email me from that, it'll get to me. Or you can email me directly, al@drdanenberg.com. I am available. And I don't have a whole lot to do, so I will answer your emails.
Okay, we've got, this will be up on the website and by tomorrow.
Oh,
so
wow,
you guys
cool.
look for it just in case you missed the recording or you want to listen to it again. And we'll have something again tomorrow night at 6. Oh, actually something at 5 as well for the hygienists.
I see Teresa Scott is over there. Let me say, hey. I just see the name.
Hey, how are you?
I'm great. I'm great.
That I was able to catch it. Today was my emergency day, and I